Namaste, greetings from AVP Research Foundation, and welcome to all our viewers, the enthusiasts who are interested in Ayurveda, the students of Ayurveda. I'm Dr. Somit from AVP Research Foundation, and today we are going to discuss about a very important topic, which is becoming very rampant, and more newer cases of allergy, specific allergic urticaria, the skin rashes are becoming popular. What is very unique about this situation is uh, it impacts both the adults as well as children in any age. And as we all know, urticaria or these allergic rashes or hives, they are episodic. They may not be there always bothering you, but there are certain precipitating factors which tends to instigate or propel its sudden appearance. And major symptoms would be sometimes reddish rashes, which can be elevated or non-elevated and quite itchy. And it generally bothers your overall quality of life. It impacts your sleep. Sometimes it impacts your daily activity. And this can, vary in shape, size, location. Many a times very difficult that people get sudden swelling in their lips or in their eyes or in a particular part of the body, in the joints or in hands. And typically they stay for a few hours to up to 24 hours and then weans off or fades. So in Ayurveda, we have a very specific mentioning of three conditions called Shitipitta, Udarda, and Kotha, which very much resembles like a very similar situation. We should not go to a kind of a gross correlation, but if you look at are there insights from Ayurvedic text about this situation, then we would say yes, probably it kind of matches to these clinical conditions told in Ayurvedic scriptures. And when we talk about Ayurveda, of course, we say tridoshas are the fundamental cause of any imbalance. And in this disease, primarily, we see kapha and pitta imbalance in acute situations. So the main dosha which tends to kind of resemble the whether it is itching, which is a kapha symptom, whether it is redness, which is pitta symptom, the elevated spots, which is again the uh, pitta symptoms. These are said to be as an acute onset of urticaria. If you also go through the classification of urticaria for that matter, uh, it is acute, chronic, or physical urticaria or cholinergic urticaria. These are four basic types of urticaria. If you see the acute urticaria symptoms basically resembles a lot on kapha and pitta imbalance. But sometimes, of course, when we see a lot of urticaria which are chronic urticaria, which will kind of keeps bothering you for more than 6 months. And when you look at different kinds of tests, Sometimes it can be associated with um, eosinophilic factor being higher, or there is a test called immunoglobulin E, IgE test, sometimes maybe also higher. Recently, we are seeing a lot of such patients coming to us where there is higher levels of IgE in the blood serum, and then they often get such kind of, but it is not always that both the blood marker and symptoms should coexist, but many a case it is seeing that we have IgE elevation. And in such cases, we see the nature of pitta and vata, because it becomes chronic. With the chronicity of this condition there in your body, you see the involvement of vata more and more. Now, what was very interesting to note that why in Ayurvedic text it was called as Shita Pitta, and the one of the major explanation is Sheet Maruta Samsparshat. So many a times when you get exposed to very extreme temperatures or extreme situations, that means you are in an AC room and suddenly exposed to very hot sun, or very hot sun you are, and then go and drink cold water, or you are going around in a hot water pool and then suddenly jump in a very cold water pond. All these kind of different like you are very sweaty and in a lot of body it is high, and then suddenly you take a very cold shower. All these can be a precipitating factor for the such kind of immunological responses, or the response which called as Shita. So the basic uh, symptoms, if you look, it is uh, the itching, what we say pertussis. It can be raised, elevated um, skin lesions, and then also if you look at the causes, so generally the acute urticaria as per the existing literature is basically due to immediate cause, like an allergy to some kind of a dust, or allergy to certain kind of fungus around you, infectious things around you, or food, or some kind of also drug. The chronic urticaria basically is found to be more because of autoimmune or idiopathic cause, because many a times most of the food test, allergy test, or other allergic markers is not found to be elevated, but still kind of you get the symptoms. There is also one subtype of urticaria told in Ayurvedic text is physical urticaria, that is which kind of increases by a sudden pressure application. You may see many people, suddenly uh, hold the hand very tightly, and then they get reddish rashes, some itchy rashes, or exposure, as I was telling you, exposure to extreme cold, heat, sunlight, vibration, or water. These are the physical urticaria. That means the physical external causes. And in fact, in Ayurvedic text, this kind of urticaria has been more described as udarta, like physical urticaria, sheath pitta udarta causes. So it can be very seen as a very correlation to a physical urticaria. Then, of course, we have cholinergic urticaria, which is uh, basically induced by a lot of heat, sweating, stress, exercise, uh, these kind of physical activity which alters your kind of or impacts your hormonal thing. Recently, in our clinical practice, we have been finding out a very unique condition of having urticarial kind of rashes connected to especially in women with their menstrual cycle. Uh, we are getting a lot of patients now coming that with the premenstrual period, a lot of young women or in in their mid-age, they are seeing these kind of urticarial responses where somewhere uh, the hormones are playing a major role. Uh, so this is also in our common day-to-day clinical practices is becoming more prevalent, and management of such kind of urticarial responses or such kind of dermatitic response becomes very sometimes aligned with the whole hormonal profile. So what we want to say in nutshell is that when you have such kind of situation, you should properly visit an Ayurvedic physician, understand the background causes, and then uh, plan a course of therapy. Now, let us try to discuss is what are the common documented triggers. So food is a major part of our lifestyle, and if you look at food, basically we see a lot of seafood these days. A lot of seafood allergies are becoming rampant because uh, invariably we are taught that white meat and that too seafood are very rich in omega 3. Of course, there's no doubt about it, but we see a subsection of population where they get, after eating seafood, such kind of urticarial responses or allergic responses. Then second important thing is a lot of people are coming with this kind of allergic response after taking mushrooms. So it's now becoming a kind of cult, a new fashion that if you are vegetarian and you want to supplement your uh, protein requirements, you go to take a lot of mushrooms, which in fact some mushrooms have been also advised or kind of advertised to have to improve the immune system responses. But we see that certain sub uh, section of the population may not respond to mushroom properly, and we are seeing the onset of these kind of urticarial skin allergies also after taking these kind of mushrooms. Third important thing is nuts. All these are very important source of protein, but we have to understand that what kind of protein we should indulge in. And we get people like taking nuts which is not indigenous to their own country. For example, in India, we have been eating cashew, we have been eating almonds, we have been eating uh, kind of other groundnuts and other thing which kind of is known to our gene. But if you start taking suddenly hazelnuts and Brazilian nuts, so certain subsection, some people may get such kind of nut allergy. So you have to be very careful when you are choosing the kind of protein supplement, especially nuts or seafood or mushrooms. You need to be careful on what traditionally these kind of food, whether you were taking or not, you have a genetic history of taking that, father forefathers have been eating this kind of food or not. So try to be very careful that when you choose this. Then eggs. We, with the advent of more kind of poultry industry, uh, I see that the incidence of triggers by eating kind of more commercially grown uh, farm eggs tend to have being a very strong trigger for this. Then strawberries, of course, again, strawberry allergy is known, but again, for an Indian genotype. So there are exotic fruits and other things which uh, may be good to eat sometimes, but then they can also be potential triggers for your uh, such kind of allergic response. Then lot of use of preservatives in the food. These days, a lot of preservatives are there which are not very healthy for your immune system. So they create so in on some kind of stress on your immunological responses. So you have to be very careful in taking. Please read the label whether the kind of preservatives are very good to take or not. Then, from Ayurvedic perspective, which is lacking in right now in modern pathophysiological thought processes, concept of viruddhahara, what to combine with what. So we often go and take smoothies and some kind of milkshakes, and we add milk with certain citrus fruit. For example, orange with milk, or even certain amount of strawberries with milk, blueberries with milk. So see, we need to understand the science of compatibility, and that Ayurveda has talked about um, rasa viruddham, viri viruddham, uh, all these samskar viruddham. There are 18 types of viruddhas in Ayurvedic text, which is told, which has to be looked into before you make a recipe. You need to see that the incompatibility, inherent incompatibility, either in bringing combining two food products or processing of the food product should not be there, or also serving the food product in specific in container, in the plate what you eat also interacts with the food. And these incompatibilities create such kind of immunological stress in the body, allergy, and then um, can turn out to be the cause of these kind of skin allergies. Then taking of excessive sour, spicy, too much of salty. See, these days we are rampant when in the fast food culture we eat more salt than what we require. I think this is also very important aspect you have to understand in kind of preventing such kind of allergic responses. Fermented food. These days, we have forgotten the old methods of fermentation. So, because with the industrialization, we take a lot of pickles and other things which have added preservatives and vinegar and all kinds of chemicals, which kind of makes these fermented products more tastier, process it faster, but at the cost of your health. So, or when you are not eating fermented food properly processed in a proper duration, like for example, there are a lot of new age fermented drinks which does not undergo proper fermentation process, and then immediately kind of without a proper fermentation, because a proper fermentation takes anything between 2 days to 15 days to 1 month. So nobody is ready at industrial level to wait for so long. And then, or other thing is bakeries. These days, lot of people are taking baked stuffs and new kind of compositions and combinations which are baked. And these are also one of the cause of such kind of allergic responses. Deep fried food, again, nothing to say, fast food, which are deep fried. Of course, it tastes good to your palate, but these are the cause of such allergic responses. Then stress, of course, lack of sleep. People fail to realize that how sleep can be central to their good immunological response, because there's enough now data available that a 6 to 8 hours of sleep, that too between 10 o'clock to morning 6 o'clock, that is the time for sleep. Not that you are going to bed at 2 o'clock and waking up at 8 o'clock in the morning and you say 6 hours of sleep is enough. No. So you need to plan your circadian rhythm, and so that the metabolism, your gut microbiome, and your immunity has a proper balance. If you don't create that synergism, it will lead to such kind of autoimmune responses. Another important thing where gut plays a major role in Sita Pitta Udardam, Otam, or these kind of urticarial diseases is importance of Agni, because we say that uh, because of diet and lifestyle factor. It was not that external, always an external factor can impact your immunological system, but it can be just your weak agni, your weak digestion, which uh, and that is only there when you understand what is the kind of microflora. So if you have a lot of gut pathogens which creates gut endotoxins, or your digestion, the food which you eat is not properly digested and kind of creates colony of host of pathological bacteria, it starts creating these endotoxins and precipitates or this kind of response which is allergic in nature. So if you look at other part, we say there is also very important concept of dushi visha in Ayurveda. Uh, Many of these conditions we see what work in patient is treatment of artificial poison, which is called as dushivisha, which is maybe chemical induced, like preservative, or sometimes drug induced. Can be any drug which is not suiting your system. So, and or a synthetic drug. Uh, we get allergy to this, and then it creates such kind of allergic responses. And this concept in Ayurveda is categorized under Dushi Visha. So, treatment of Dushi Visha is a very important kind of, strategy to treat chronic urticarial responses. And we are getting lot of people responding to this kind of core non-histemic response. Because see, what happens is, from modern physiology perspective, it's just a histemic response, but then many of them do not uh, aptly adequately response to such therapy. And there are always a reoccurrence, so that you are always constantly on these kind of new age histamic drugs, or sometimes you know uh, immunosuppressant drugs. Now in Ayurveda, the moment we talk about histamine, the first drug comes is turmeric, neem, guduchi, triphala. But we forget that it can, of course, only impact a subsection. It can be good for a particular subsection of um, such kind of allergic diseases population, but it does not suffice to the whole plethora of kind of patients which comes with different background. If the background is Visha, if the background is Ama, you need to work off with Langhana, Deepana, Pachana, as well as Vishahara Chikitsa. And the people fail to, even we have seditium. So we have been seeing that such kind of herbs are playing now crucial. Even Jatamamsi is a very important drug in this, told in Dusivishari Agada medicine, which we use now in this allergic responses, hyperallergic chronic responses, or even Madhuyashti. If you look into these days, where women are getting such kind of allergic responses just before their cycle, the Madhuyashti plays a major role, and told in Sitapita Dartha Chikitsa in a very specific way. Now, why I'm trying to discuss all these things is because don't just see these kind of urticarial allergic response as a histamic response. There are much deeper now pathophysiology, which can be associated with the gut, with some other reasons like artificial poisons, and or kind of, which is like the chemicals we add to as additives in the food, or in form of synthetic medicines also. So this is very important for us to understand. Now, if these are, then what is the Ayurvedic approach to management? I talked about few herbs, but then if you categorically understand, we know the Panchakarma or programs are very important, or a cornerstone of Ayurvedic management. So Shodhana process, uh, in that, the first line of therapy, whether at outpatient level or at our hospitals, we prepare the body for these shodhanas, and virechara is one of the first line of therapy. In fact, uh, it's excellent response for both pitta and kapha, because we know that both the pitta and kapha sthana, urdhva or the upper part of the stomach, is kapha place, and then the pitta place follows after that. So this is very important therapy of panchakarma. When you talk about Shamana Chikitsa, one very interesting, home remedies have been told, and use of Sharshapatailam, mustard oil, or Sarson ka tel, uh, Kadagana. It's very much kind of, told in this. So even like, if you massage your body where people are not allergic to mustard oil, if you apply in the body and take a bath, uh, it helps. See, of course, again, the objective of this deliberation is not to suggest you any medication or anything in particular, but I'm just talking about uh, what are simple things which we can do. Of course, you need to go to your treating doctor for uh, getting deeper into addressing your these responses. But from our evidence-based practice is what we are trying to share, that this is a very important process for panchakarma process, which helps such kind of allergic responses. And uh, in our text, it may not be just very much into Shodhana method, even being part of your regular lifestyle once in a while, doing a gut cleansing through use of certain advised what your treating doctor or your therapist advise you. Based on that gut cleansing you can do, especially like virechana. uh, what Another important thing is what kind of food you should take. So taking food which is lighter to digest, non-acidic, it's not be acidic. So especially when you're talking about fats and proteins, they have to be taken with care, because they are heavy to digest, difficult to metabolize, and you need to take most of these, which should be in the morning session, in breakfast and lunch. Avoid kind of, things which are very spicy, especially in fact, ajumodam, like, the celery seeds or omam, along with jaggery, is an excellent therapy for this. That means, uh, but yes, at the same time, if you talk about red chili, it is contraindicated in such condition. But when you talk about ajumodam, omam, or ajwain with jaggery, it has been told as a therapy. So why? Because it's also kapha. So we have to strike a balance first, whether it's a vata and pitta condition which is chronic. There such kind of hot prayogas and hot usage cannot be done. But if it is kapha and pitta, that's why I have been telling you that these kind of recommendations only has to be followed as when you go and visit your consultant, and then you can take a call. But these are some things which is out of your own house kitchen also. Such kind of responses can be taken care of. Then you need to take less refined sugar. See, the very important part is, you know dependency on all the refined sugars. They do impact your gut microflora, and then that kind of gut pathogens tend to impact the occurrence of such kind of urticarial situations. And then try to take more fresh fruits, non-citrus in nature as much as possible, and take fruits between your breakfast and lunch, or between lunch and dinner. Take proper meals, and you should avoid overeating during the night, of course. And then doing a very important part would be uh, how do you regulate your sleep cycle, stress management, and pranayamas, which like Bhrastika pranayama, which increases the digestion, provided you don't have contraindication like blood pressure, heart disease. So those condition of which are contraindicated for Bhrastika pranayama is very important, good for such kind of conditions. And of course, the most important thing, as I was telling you, if you have any query, visit your healthcare provider. So at AVP Research Foundation, we have constantly worked to document, and what we believe is in practice-based evidence. So that's why if you have more queries about such situations, and especially urticaria, you can visit our website, or you can call us at our contact numbers, and uh, do seek our advice if required, or look through our website about further informations. And please join our YouTube community, where such kind of live streams and educational information materials would be always shared. Thank you from the behalf of AVP Research Foundation.